Like I said, I am Kelly Norge. I am doing my topic on the benefits of animal-assisted therapy for veterans with PTSD. First, I would like to thank Dr. Sklar. This semester has not been the easiest for me, so I wanted to thank you for your support, as well as the veterans who are or have currently served in the United States military. My presentation overview, we will be talking about what animal-assisted therapy is, the benefits of animal-assisted therapy, what it takes to become a therapy dog, the veterans' benefits, what exactly PTSD is, the ADA guidelines, my recommendations, and then my conclusion. How many of you have either a dog or a cat or both? Just by show of hands. Wow, that's actually a lot. Okay, I wasn't expecting that many. How many of you have ever felt anxious, stressed, sad? I know I have, especially right around this time. And then how many of you have felt better just being around your animal, even if it's for a short period of time? There's just something about them when they look at you that just makes you feel better, right? Basically, that is, your own little form of animal-assisted therapy. So what exactly is animal-assisted therapy? It is the use of animals in a therapeutic setting to assist the client's recovery process. It builds the trust and safety of that person, and it allows for communication to open. I have a short video that kind of says exactly what animal-assisted therapy is.
Meet Skylar and Opie. They may look like just a couple ordinary pets, but these dogs are much more than just man's best friend.
I had 2 brothers and a sister in the service, in the Army. We wanted to get back to them. And their main job is troop greeting, and it became addicting. They became addicted to the dogs.
According to handlers Cheryl and Ron Lair, Skylar and Opie provide not only smiles and belly rubs, the hounds may also be giving clinical aid to the troops in helping to cope with post-traumatic stress disorder.
Unless you have it, you don't really understand all of the dynamics of PTSD. It is truly what these troops go through in battle. But the fact is, you have to talk to people about that. And some people don't trust talking to other people. And yet those dogs offer that avenue. They'll still cuddle up to you, and yet you're able to dump some of that garbage off.
About 40,000 troops have been physically wounded in Afghanistan and Iraq, but 10 times as many show symptoms of PTSD. One study shows that 82% of participating veterans have reported fewer PTSD symptoms since having a dog, and 40% say they're using fewer medications.
It actually does put a smile on my face to see a dog. It's good seeing an innocent little pet like this.
I really do think it helps, because what it does is it lets them forget what they see.
They don't have to be soldiers. For a minute there, they can just be human again.
On top of being cute and cuddly, most researchers agree it's the dog's non-judgmental demeanor that really aids the soldiers.
They're non-judgmental, and you can always go back to, loud noises, but as long as that dog's there, they know they're safe. And it becomes a safety zone for them.
Skylar and Opie are so loved, in fact, that Cheryl and Rod have to be careful that they aren't snatched up by departing troops.
No, this one.
No, not that one either.
Okay.
They have been measured, and they will fit in a knapsack.
To keep up with Cheryl and Ron, and of course also Opie and Skylar, you can look for them on Facebook.
For some reason, it always seems like no matter what, when you're around your animal, you can just open up. It seems like you're able to talk more, and you're just able to get out whatever feeling you need, basically because they are non-judgmental. So why animal-assisted therapy? It has been proven that psychiatric patients exposed to pet therapy were able to better control their anger, experience decreased depression symptoms, feelings of distress, and exhibited reduced anxiety. The animals are non-judgmental, and it opens up the communication and interaction between the patient and their therapist. People just seem to feel more comfortable around animals. It's easier for them to sit there and pet a dog while a therapist is asking them questions. It seems to kind of just get their mind off of it. And you know, it's just their faces are so cute. And you know, who wouldn't love that face? Realistically. For me, it's easy for me to even open up to my animals. I have 2 cats and a dog personally, and I can sit there and tell them anything, and they just kind of sit there and stare at me like, okay, well, whatever. Just keep talking, and you know, you can pour your heart out. Animals are able to give emotional support, reinforce the feelings of independence, and stimulate awareness. And it also aids in a calming and reducing distress in patients. So what does it take to be a therapy dog? There's the basic training commands of sit, stay, and lay down. There's a temperament test that includes a behavioral test on whether or not they're aggressive when there's food around, or if they startle easily. They have to drop keys, open up umbrellas, and see how the startle test is. If they are kind of jumpy, there's ways to work on that, but for the most part, if they have a pretty good temperament, they're really good candidate to become a therapy dog. And then they also have to respond to the working environment. That means if they're at a hospital, traveling up and down the elevators, knowing, you know, where to go and where not to go, basically. If they're only allowed to be in certain areas of the hospital, making sure that that dog understands that and training them properly for that working environment. Also, to, you know, be able to be around